Good evening, everyone. Welcome to the Hudson Medicare 101 Educational Workshop. My name is Shahe Galstian. I am a licensed health insurance professional, and I'm also a licensed financial professional with 26 years of experience in the financial services industry. I commend you all for being with us tonight because we'll be discussing something very important, which is our health insurance and Medicare. And before we begin, I'd like to mention two things. One is that if you notice to the right of your screen, there's a box there, and that is for messages. In other words, throughout the presentation, if at any point there's something that stayed with you or that pertains to you and you want to ask a question about it, you can go ahead and type your message there, and I'll be checking periodically for questions. And I'll take some time out and answer your question as best as I can. And I've been doing this long enough to know that I can't know everything. So if I don't know the answer to your question, I can assure you that I will get the answer for you. And secondly, you'll notice at the top of the screen, there is a red button that says schedule. If you would like to schedule an appointment for you and I to speak one-on-one about your unique circumstances, whether it's this way via video or just a phone call, you can go ahead and click on that schedule button, which will take you to my digital calendar. There you can schedule a date and time that is convenient for you, and we can speak confidentially. Okay? The agenda for this evening will be discussing the 4 parts of Medicare, Part A, B, C, and D. We'll be discussing the gaps in Medicare, and this kind of goes back to, you may have seen the commercials on TV that say, Medicare covers 80% and the rest is up to you, right? So we'll be discussing those gaps and options to cover those gaps, when to enroll in Medicare, which is important, and of course, how to choose the best strategy for you. The 4 parts of Medicare are Part A, which is your hospital insurance. Part B is medical insurance, meaning doctors outside of the hospital, doctors and specialists. That's Part B. Part C is something called Medicare Advantage plans. You may have been bombarded with this in the mail. It's been in commercials, especially this past fall. Medicare Advantage plans, which is Part C, are private health insurance companies, such as HMOs, which stands for Health Maintenance Organizations, and PPOs, which are Preferred Provider Organizations. Provider means doctor. And we'll get into that. So Part C is Medicare Advantage, which includes Part A, which again is hospital insurance, and Part B, which is doctors and specialists. And finally, on the right is Part D, which is prescription drug coverage. Part A, hospital care. There's no annual premium for Part A. And that's assuming that you've worked at least 10 quarters, 40 quarters, excuse me, that's 10 years. If you haven't, if you've worked less than 10 years, then you may have to pay a premium, and we can talk about that individually one-on-one. But for all intents and purposes for now, there's no premium. However, if we look here, there's a strange number. It's $1,484 deductible per hospital occurrence. Now, firstly, I didn't come up with that number. That is a government number. And basically what it means is that, God forbid, you ended up in the hospital. If the first $1,484 would come out of your pocket before Medicare kicks in. The first 60 days are covered 100%, the first 60 days in the hospital. From 60 to 90 days, you start paying out of pocket, and from 90 days beyond, it gets even more expensive. And the first 20 days of skilled nursing is covered also 100%. And people say, what is that, skilled nursing? A skilled nursing facility is, for example, you, God forbid, broke your leg or your arm, and you ended up in a rehabilitation center. That's called a skilled nursing facility. And again, the first 20 days of that kind of care is covered 100% by Part A of Medicare. Part B medical services. Again, this is outpatient, outside of the hospital, doctors, specialists. Part B medical services, the monthly premium is $148.50 per month. Now that depends on income, and we're going to get to that in a little bit, but it starts at $148.50 per month for Part B, which is doctors. Covers medical services outside the hospital, doctor visits, lab work, x-rays, ambulances. You'd be surprised how much an ambulance ride costs these days. Emergency room and outpatient surgery. And if we look again further down here, an 80-20 plan with Medicare paying 80%. And again, the rest is up to you, right? We'll talk about that. The annual deductible for Part B is not as bad as the Part A deductible, $1,484. It's $203. So again, for the outpatient care, meaning doctors and specialists, the first $203 in any given plan year of yours, the first $203 is your annual deductible, meaning that's what's coming out of your pocket before the Medicare Part B kicks in. Now let's talk about the income and how that affects your potential Part B premium. So if we look at the upper left, my joint income, and this is for married couples. Married couples with a joint income of $176,000 per year or less, your monthly Plan B cost is $148.50. And as we move along to the right, the higher the joint income is, the Part B premium increases until once you're $750,000 in joint annual income or more, your Part B premium would be $504.90 per month. And if we go back to the left and down to individuals, my individual income, $88,000 or less per year. Again, your Plan B premium starts at $148.50. And it goes up the scale as the income increases to, and we go all the way to the right, if you're making $500,000 or more per year, your Part B premium is $504.90. What you don't get with Parts A and B, so this is original Medicare, Parts A, hospital insurance, right? And Part B, doctors and specialists. You don't get any dental coverage, vision, eyeglasses, right? Prescription drug coverage, not included. Hearing, such as hearing aids, and help with long-term care, which is very important. We're not going to get into that tonight, but a lot of people ask, what is long-term care? And for those who don't know, long-term care is a type of insurance where for those who do not want to go into a nursing home and would rather stay home and receive private care from a healthcare professional. And that can be very, very expensive if you don't have insurance. But since we're talking about Medicare, all I'll say is that the long-term care insurance is not covered by Medicare Parts A or B. When can you delay enrolling into Part B, the doctors and specialists, right? If you are actively employed and covered under an employer health plan, or you're covered under your spouse's health plan. So if your employer offers you a group health insurance plan, you may choose to stay with that plan and delay enrolling. And we'll get into some of the things that you need to consider if you're in that position on whether or not to stay with the employer group plan, or whether to consider Medicare on your own. All right, retirement. Now, where do you go? Do you make the left and go with an employer, or stay, I should say, with the employer group health plan that you have as an employee, or your spouse has that you're covered under, right? Do you go straight and go into a supplemental plan? Okay, what that means is you're choosing Original Medicare, which is Part A, again, that's hospital insurance, and Part B, which is the doctors and specialists. And in order to fill in those gaps, right, 80% Medicare, the rest is up to you. The supplement insurance plan, which are Medicare and supplemental plans, and they're also called Medigap plans, these are the plans that fill in those gaps so that the rest is not up to you. You are now covered for what Medicare doesn't cover. So are we going to go with staying with the employer group plan? Are we going to go with Medicare and a supplemental plan to cover the gaps of Medicare? Or are we going to go to the right with a Medicare Advantage plan, which combines Part A, hospital insurance, right? And Part B, the doctors and specialists, and also has potentially a lot of other benefits. And a lot of Medicare Advantage plans have benefits that Original Medicare doesn't cover, such as I mentioned earlier, hearing, dental, vision, chiropractic, and we'll discuss that even a little bit in depth because that's important when it comes to making your decision. Retiree or union plan. Okay, so if you're part of your employer's group health insurance plan or part of your spouse's group health insurance plan through his or her employer, there are questions you need to ask on whether or not you're going to stay with that plan or move out of it to go to Original Medicare or to a Medicare Advantage plan. Are there copays and deductibles? Copays, as you may know, are when you first walk into the doctor's office without anything even happening, you're being charged $25, $35, $50, maybe even more sometimes. Those are copays. And the deductibles, which are what's coming out of your pocket before the insurance kicks in. That's an important thing to ask because you're going to compare that to Medicare and Medicare Advantage plans. Does it include a drug plan? Very important as well. If I opt out, can I opt back in later? Some group health insurance plans will let you leave, but they won't let you back in if you change your mind. So that's important to ask as well. What's the cost of the plan? Because it doesn't matter how great a plan is if you can't afford it, right? And finally, does it include dental and vision coverage? Okay. Moving right along. Medicare supplement plans. Again, these are insurance plans that cover parts of that Medicare, Original Medicare, does not cover. Those gaps. They're called Medicare supplement plans or Medigap plans. They are federally standardized plans offered in all states, including DC. There are 10 plans alphabetically from A through N. Some cover a lot of gaps or all of gaps, and some cover a percentage of gaps. And of course, because of that, they have different costs as far as how much you're going to pay. Plans A through N offered in most states, and all policies offer the same basic benefits, which makes life a little easier. Don't let this screen intimidate you because I'm going to keep this very simple. You'll see A through N. These are the Medicare supplement insurance or Medigap plans. And we're going to stick with the one in the middle. We're going to hit the one in the middle, G. Plan G. Why? Because it's the most popular one. And I'm going to use that as an example. So on the left side of the screen, you'll see benefits. So the first one down says Medicare Part A coinsurance and hospital costs. So if you're hospitalized, God forbid, the parts that Medicare doesn't pay, this Plan G supplement plan or Medigap plan will cover that. Going down again under the benefits column, Part B, coinsurance or copay. This applies on Part A is for the hospital, Part B is for doctors. So any gaps in coverage when you're seeing a doctor or a specialist, this Plan G covers that. The next one down, people ask me a lot about it, says blood, first 3 pints, which may look strange, but when your blood is taken, it's actually very expensive. So this is an important one. the first 3 pints of the blood that is taken is covered by Plan G. Skilled nursing facility, if we go down again, one down, which again is a rehabilitation center that I gave you an example of earlier. Co-insurance costs for the skilled nursing facilities are covered by this plan, Plan G again. We're looking at Plan G. Part A deductible. The Part A deductible, if you recall, is $1,484 out of your pocket before the Medicare kicks in. So this plan covers that, which can be very important to people because that's a considerable amount of money to come out of your pocket. Part B deductibles are not covered. Thankfully, it's only $203. Part B excess charges are covered, and if you travel a lot, and if you are a traveler, I know you're dying to get back on at the airport, and that's slowly and surely coming back, which is great. And if that's the case, then foreign travel emergencies, God forbid, are covered 80% by this supplement plan. So this, to surmise, whatever Medicare is not covering, and the commercial says the rest is up to you, well, you have an answer to that now with these Medicare plans or Medicare supplement plans. These 2 plans, you'll see Plan C and F, they are discontinued, so that's going to save us time. Okay, Medicare supplement or Medigap plans. When it's the best path, we want to budget medical costs. This way you know what's coming out of your pocket, what's being covered. If you end up in a hospital, God forbid, right? Or you have to see a specialist for something. Traveling, if you're a big traveler, including if you have a second residence outside of the state and may need to see a doctor away from home. And that's important for people who do a lot of travel. You can see any doctor or specialist that accepts Medicare. So you're not part of a list of doctors that you have to choose from where you live. And instead, with the Medicare supplement plans, you can see any doctor across the country as long as they accept Medicare, which is a lot of flexibility. Some of these plans have no co-payments, which is great, and no deductibles, which is great as well. And you don't need a referral. There's no referral requirement. Okay, Medicare Advantage plans. So this is Part C of Medicare, the 4 parts of Medicare, right? Part A, hospital insurance. Part B, doctors and specialists, right? So Part C combines Part A and Part B. Okay, Part C replaces A and B and can include, Part D, which is prescription drug coverage. So a lot of Medicare Advantage plans, and by the way, they've come a long way in the last 5 years or so. They not only cover Part A and B, hospitals and doctors, but they also provide you with prescription drug coverage, which is fantastic. PPOs and HMO network of doctors. Again, preferred provider organizations, PPOs, and HMOs, health maintenance organizations. These are private insurance companies. They have a network of doctors. The PPOs allow you to go outside of the network. Let's say your primary care physician. If he's not in network, a PPO plan allows you to go outside. You may have to pay a little more for it. With an HMO, they'll give you a pamphlet of alphabetically listed doctors in their network for you to choose from. There are 20 plans available in Hudson County in New Jersey. If you live in the surrounding county or any other county in New Jersey, that is fine as well. And this next one down is very important. It includes a maximum out-of-pocket. So Medicare Advantage plans have a maximum out-of-pocket, meaning the most in a given plan year that would come out of your pocket. Okay? Let's say you had a bad year health-wise. The most that you would be paying out-of-pocket would be for 2021, for the year 2021, is $7,550. Unlike original Medicare, with a supplement plan to cover the gaps, which has no maximum out-of-pocket, meaning you could potentially pay more. So that's something to remember as well. And we can discuss that one-on-one as well if that's important to you. Maximum out of pocket, the most that could come out of your pocket on a Medicare Advantage plan, $7,550. And you can choose plans annually through what's called an annual enrollment period. We're going to get into there are 3 enrollments periods that we're going to discuss. We'll get to that shortly. When it's the best path to go with a Medicare Advantage plan versus original Medicare, right, which is just Part A, the hospital insurance, and Part B. So when is it best to go with Medicare Advantage, which combines Part A and B, and oftentimes has Part D, the prescription drug coverage? It's if you're wanting a lower monthly premium. Now, a lot of these Medicare Advantage plans have literally a 0 monthly premium, okay? You still have to enroll into Part B, which is the doctor coverage, and pay that $148.50 per month that we spoke about earlier in order to obtain a Medicare Advantage plan. So you'll have to pay the Part B premium, but there's no excess premium on top of that for many of these Medicare Advantage plans, which is fantastic. It's used as a backup for the Veterans Administration services. So that means if you're a veteran, and if you are, thank you for your services. Oftentimes, veterans don't want to wait in line for healthcare, and unfortunately, that's the case. It happens. So veterans use Medicare Advantage plans as a backup if they want immediate healthcare. And if you're Medicaid, Medicare eligible, Medicaid is a financial aid, if you will, to help cover your healthcare costs. And we'll talk about that briefly as well. Prescription drugs. So this is the 4th part. We're getting there, folks. This is the 4th part, Part D, prescription drugs. D, drug. It's easy to remember if you look at it that way. Prices vary by county depending on the plan, and they start at $7.30 per prescription per month and can go up depending on your plan. Included with some retirement plans. That goes back to what we talked about earlier with whether or not you should stay with a group employer health plan, and that you should ask them if they have dental coverage. Late enrollment penalties may be imposed. What that means is when you become eligible for Part D, if you do not enroll in it and you were not involved in a group health plan that had credible coverage, you'll be penalized 1% per month that you became eligible. Now, one of the reasons why I'm here is to make sure you don't pay a penalty. There's no reason for anybody to ever pay a penalty. So if you annualize that, and let's say you were a year late, you'll be paying a total of a 12% penalty, 1% per month for 12 months, and that's a permanent penalty. So we don't want that to happen. Veterans exempted from the requirement to enroll, they are exempt from the requirement to enroll, but may choose to do so anyway. And again, you can choose plans annually in what's called an annual enrollment period, and I'm going to get into that. Extra help with prescription drugs. There's something called a low-income subsidy, and in order to qualify for this financial assistance, you have to have an annual income of less than $19,140 as a single and $25,860 for married couples. Your resources must be less than $14,610 for singles and $29,160 for married couples. So basically, if you're driving around in a Ferrari, you may not qualify. It may also help with deductibles, co-pays, and premiums, which would be great. Okay, the 2021 prescription gap. This is also known as the donut hole. You may have heard of it. Coverage gap begins, and this is your coverage on your prescription drugs, right? Begins when you and your drug plan spends $4,130 in a given year, a plan year. From $4,130 to $6,550, it's what's known as the donut hole or the gap, where you are paying 25% of the cost for generic drugs and brand name drugs. 95% of this, stay with me here, 95% of that you're paying goes toward your out-of-pocket. Your out-of-pocket, which is called the catastrophic phase or coverage, is after $6,550. So once you pass the gap between $4,130 and $6,550, you get to the catastrophic stage, where your prescription drugs will be running anywhere from $3 approximately to $10. And that's the gap. And again, we can discuss that further. And just to remind you, everyone, the red schedule button is up there. If you want to schedule with me one-on-one, just click there and it'll take you to my digital calendar and you can choose a date and time convenient for you. Okay, this is probably the most important slide we're going to look at, and it gets easier from here. It's downhill from here. Okay, this is a comparison of the left side, which says Medicare supplement plans, right? These are the plans that coincide with original Medicare. Again, original Medicare is Part A, hospital insurance, Part B, doctors and specialists. And since Medicare has gaps, Medicare supplement plans are the plans that fill those gaps. So we are going to compare the original Medicare with Medicare supplement plans versus the right side, which is Medicare Advantage plans, which again, they combine A and B, hospital and doctors, and often have a lot more benefits, including prescription drug coverage. So let's do this. Left side, going down on the first bullet there, fills the gap of original Medicare, right? That's what a Medicare supplement plan is. Look to the right, Medicare Advantage plan. Replaces original Medicare, which again is just Part A and B, hospital and doctor. Back to the left and one down, prescription coverage. There's no prescription drug coverage in original Medicare. Can be paired with a Medicare Part D prescription drug coverage. What that's saying is that you can have original Medicare, Parts A and B, and then have a standalone, separate prescription drug plan, Part D. Versus, on the right, again, Medicare Advantage often includes Medicare Part D prescription drug coverage. Something to consider. Again, we'll go back to the left and one down again. Typically accepted by any provider that accepts Medicare. So Medicare supplement plans are accepted anywhere in the country as long as the provider or the doctor accepts Medicare. Versus, again, to the right, with Medicare Advantage plans, coverage usually is network-based, like an HMO or a PPO. And that's why it's great to have help from a professional to make sure that if you're choosing a Medicare Advantage plan, that your primary care physician, if you have one, is in that plan. Back to the left and one down. Monthly premiums typically range from $85 to $150. Again, that's per month, but they vary by plan and geography. And to the right with Medicare Advantage, premiums can be as low as $0. Again, $0 per month, but you're still responsible, like I had said earlier, for the Part B premium, which starts at $148.50. We'll go further down one to the left. Premiums can be affected by age and gender, versus to the right, premiums are not impacted by age or gender, but they do vary by county, where you live, your zip code. Further down to the left, health questions may be asked to determine your eligibility for a Medicare supplement plan. However, let me just say this. When you first enroll into Medicare, if you decide to go with original Medicare, just Part A and B, and have a Medicare supplement plan, when you enroll in Medicare, that will trigger a 6-month window where you can obtain a Medicare supplement plan with no questions asked. No medical, no blood, urine, nothing like that. Versus, again, to the right with Medicare Advantage, You are guaranteed acceptance, except for those with end-stage renal disease. Back to the left and one down. With a Medicare supplement plan, benefits are the same regardless of which company offers them. Versus, to the right, with a Medicare Advantage plan, benefits vary by company and out-of-pocket costs are capped. Remember, that was the maximum out-of-pocket that I mentioned. In a Medicare Advantage plan, in any given plan year, you will not be spending more than $7,550 out of pocket. Versus with original Medicare, and the left side again, original Medicare and a Medicare supplement plan, unfortunately, there is no maximum cap. And the last one on the bottom left, enrollment is year-round. There are no enrollment periods, okay? The way there are with Medicare Advantage plans to the right at the bottom. Enrollments are limited to initial enrollment periods, annual election periods, and open enrollment periods, as well as special circumstances throughout the year called special enrollment periods. So I will discuss that briefly with you as well. Initial enrollment period. This is when you first become eligible upon turning 65. Your initial enrollment period is the 3 months prior to your birth month, the month of your birth month, and 3 months after your birth month. Okay? So let's take an example. We're in the month of March, right? So December, January, and February are the 3 months prior to your birthday if your birthday is in March. So your initial enrollment period starts in December of 2020, right? And then December, January, February, March is included, the month you're born, and then the 3 months following that. So April, May, and June. So from December to June, that 7-month time span, that is your initial enrollment period in order to enroll into Medicare. And I highly suggest that you do it and enroll as soon as possible, because the longer you wait, if you wait till the months after your birthday, then your coverage could be delayed. And if you wait even further, you might start paying penalties. And again, we don't want that to happen, right? So that's the initial enrollment period. The general enrollment period is the period from January 1st through March 31st of every year. And this is the opportunity for folks to make changes, to disenroll from one plan, to go to another plan, or do nothing. The only thing to consider with that period, January 1st through March 31st, is that if you do make changes, they don't take effect until July 1st. And the special enrollment period. A special enrollment period occurs, for example, if you move out of your county or out of the state. Let's say you moved to a completely different state where your plan is not offered. At that point, it ignites a special enrollment period for you to disenroll from the plan you were in and re-enroll to one in your county. We're almost done. How do you sign up for Medicare? If you're collecting Social Security, it's very simple. It's automatic, actually. You don't have to do anything. Enrollment in Medicare is automatic. The card arrives in the mail. This may have already happened for you about 3 to 4 months before your 65th birthday. How do you sign up for Medicare if you're not collecting Social Security? You can sign up 100 days before your birth month. Again, I didn't make up these rules. This is the government. You can call in 2 different ways. You can call Social Security directly at that 800 number listed there, or you can go to medicare.gov, which is a great website, and you can sign up at medicare.gov as well. Okay, so to sum it up, let us help you understand the upcoming changes as they relate to a unique situation. The decisions you make can impact your healthcare coverage for a long time. So let me end by saying, ladies and gentlemen, that if you choose, you can call the health insurance companies in your area, and you'll have a representative explain all of their products to you, and these are all great people. And they'll tell you what they have for you. If you decided that you wanted me to help you as an independent licensed agent, we have sophisticated technology that we use, and we can go and search your county, your zip code, for all of the plans in your area and take into consideration your unique circumstances, such as your lifestyle. Do you travel a lot? Your prescription drugs that you already take. Your primary care physician, if you have one. You wouldn't want to lose your physician. Well, maybe if you wanted to, right? But taking all of these things into consideration and delivering it to you on a silver platter so that you have all of the information in front of you in order to make an informed decision on what is right for you and what you can afford, right? And another thing I'll mention is that you don't have to worry about getting a bill from me, all right? You're not going to get a bill from me. We are directly compensated by the health insurance companies. So you're not gonna open the mail one day and get a bill from me, all right? So with that said, my name again is Shahe Galstian. My designation is LUTCF, which most people say, what is that? You know, it's not like a PhD or an MBA, right? Master's or something. LUTCF stands for Life Underwriting Training Council Fellow, which basically means that I'm a specialist with health insurance and life insurance. There's my cell phone right there. So if you decide to call me, you won't be waiting 20 minutes on an 800 number, waiting for a human being to get on the phone. So that's my direct line. And if you get my answering service, please leave a message, and I promise you that I will call you back. Shahe Galstian at ffig.com is my email. Feel free to email me. And of course, our website, which is www.hudsonmedicare101.com. Okay? With that said, I thank you for joining me this evening. I hope this information was helpful. I hope you will use it in order to make the right decisions for you, for your family, and for your health. So thank you again. If you'd like to schedule with me, just click that red button up there that says schedule. Thank you for attending.